Hello, this is a presentation of spinal cord injuries, how to assess them and treat them in lacrosse. I'm Adam Scott.
I'm Brad Duong.
So let's get started.
Alright, what to look for? So signs to look for in athletes with a spinal cord injury. You're going to have decreased heart rate and blood pressure, tenderness over the spine with and without palpation, muscle spasms, palpable deformity, painful range of motion of the cervical spine, or unwillingness to move, and loss of voluntary motor control. Alright, on-field assessment. So after you've determined the scene is safe, you're going to need to check the athlete's level of consciousness. If they are unconscious, you're going to immediately treat for a spinal cord injury by stabilizing the head and calling 911. If they are conscious, you're going to talk with the athlete, ask if he has any neck pain or any sensory loss, and then you're going to stabilize the head and then again call 911. So you need to maintain the airway, make sure they're breathing. You're going to check the pulse, check the respiration. You're going to monitor the vitals and keep the athlete calm. Provide the athlete with a neck collar and stabilize the C-spine until EMS arrives. So is CPR needed? With men's lacrosse helmets, it can be difficult to remove the face mask compared to, say, a football player. So according to the NATA, cervical spine motion was limited the most when lacrosse athletes wore no helmet rather than when they wore properly fitted or even improperly fitted helmets. So when you're stabilizing, you're going to want to limit the head motion as much as possible. So this is going to require two people to accomplish this. When removing the helmet, one person will be stabilizing the neck the whole time, while the other one will start to take off the chin strap and then start removing the helmet. So in the event that CPR is needed to be administered, the jaw thrust technique is going to be the best use because it'll minimize the amount of motion at the neck. When stabilizing the C-spine. So when possible, the C-spine should be placed in a neutral position. No traction should be placed on the spine because it can result in further injury. If the athlete is face down, use a log roll technique to place the athlete supine and the neck in a neutral position to open the airway. Never let go of the athlete until he is either spine boarded or more advanced personnel arrive on the scene. So when not to adjust the spine. You're not going to want to adjust the placement of the athlete if the pain increases while trying to move the head, the patient's neurological symptoms increase, the airway becomes obstructed while trying to realign the head, or if the athlete is apprehensive or doesn't want to move.
Okay, so now we come to the part of the presentation where I take over. I'm going to be talking about, in this section, I'm going to be talking about the equipment of a lacrosse player and how it can have an effect on the C-spine and spinal cord injuries when we're trying to assess the athlete and try to treat them and or send them off to the hospital if needed. Okay, so when we're talking about equipment, obviously the first thing that comes to mind when you think of any kind of sports equipment is football shoulder pads and helmet. However, lacrosse helmets and shoulder pads are very different from football helmets and shoulder pads. Lacrosse shoulder pads are much more thin compared to normal football shoulder pads. Plus, the design of the helmets for both sports, football and lacrosse, are completely different. The design of the lacrosse shoulder pads and helmet causes the neck to not be in proper alignment when lying in a supine position. So let's say your athlete is on his back on the turf or grass or whatever playing surface you have. the neck will not be in a proper alignment for stabilization. The NATA says that the presence of supine lacrosse athletes' equipment results in an extended cervical angle, and the helmets and shoulder pads may need to be carefully removed to ensure neutral alignment. And although more evidence needs to be conducted on the amount of motion caused when removing a lacrosse helmet. Okay, so this slide talks about the treatment of spinal cord injuries. The two main ones are hypothermia and a specific kind of corticosteroid, which we're going to talk about later. The first treatment, hypothermia, there hasn't been a lot of evidence as to the effects of hypothermia, specifically on the spinal cord and the spinal cord injuries. However, hypothermia has shown very good results in victims with heart attack, mainly because hypothermia slows down the metabolism, and it also decreases the demand for oxygen. Okay, so the main corticosteroid that we're going to talk about is
methylprednisolone.
And according to the NATA position statement, patients with acute spinal cord injury who were treated with high-dose
methylprednisolone
within the first 8 hours of injury had significant neurological improvement at the 6-month follow-up compared with a placebo group. One evidence-based review states some negative effects of the drug, such as respiratory and infectious issues. Okay, so once cleared by your doctor, you can start a resistance training program. According to the American College of Sports Medicine, resistance training can help the ability to complete daily activities, enhance body composition, and enhance motor function. So according to the American College of Sports Medicine, the best kind of resistance training to do would be circuit training. And circuit training is when the patient receives low-intensity exercises intermixed with different types of aerobic exercise. The workout typically involves 3 rounds of 6 different resistance exercises with 2 minutes of aerobic exercises in between the rounds of resistance exercise. A lot of times people who are paraplegic, the way that they get their aerobic exercises in is they perform arm movements in a wheelchair, in which they are using their shoulders to move the wheelchair forward, and or you can have a shoulder workout machine in which you are spinning a lever in front of you, to try to get that aerobic exercise going. And then there should be at least 30 seconds of rest time in between exercises. Okay, so different types of resistance exercises that you can do to help patients that suffer with a spinal cord injury. You can do weight machines, in which you can adjust the specific weights to progress them, starting from smaller weights to go to much larger weights. We can also do exercises with electrical stimulation. I know the first thing that pops into my head is Russian, and I'm sure that's the same case with all of you guys. And then we can also incorporate some resistance band exercises, some TheraBands. That's also very good types of resistance exercises. Okay, so some of the things that you need to be looking for while you're watching your patient progress. You want to make sure that if there is a spastic muscle wherever it may be, that you target the opposite muscle. So an example would be if your bicep in your arm is very spastic, then you would want to target the tricep muscle in your arms. And then you want to make sure that the exercises are varied regularly to reduce the chance of over-injury. An example of this would be you could do upper body one day and then do lower body the other day, or a different day. For patients who are paraplegic or can't walk, you could do arm day one day and then maybe a shoulder day the other day. You just want to make sure that you have to incorporate different exercises. Also to keep the muscles guessing as to what you're going to throw at them. And then you want to make sure that the patient doesn't become overheated while doing these exercises. Some simple ways to prevent that would be just to give them water, making sure that they're in an air-conditioned environment. The list can go on and on for this. And then this is a reference list in case you want to take a look at that. And so this is the end of our lecture. Thank you all for listening.
Thanks.